Okay, so good afternoon to everyone. Our topic for this afternoon in the NCM 110 Health, other nursing informatics is the hospital information system. This topic is very relevant and very important simply because these are the features of our system nowadays in the hospitals. Although in government and even in primary healthcare facilities, they have not adjusted yet into the hospital information system or through the use of the electronic health records. So they are still on the traditional and the manual way of recording, storage of their files, and when it comes to the access. But with the mandate of the Department of Health towards the direction of the e-health vision, then I think hospital information systems have been adopted in most, not all, or in most hospitals, basically on the direction of the e-health. And for us to understand what e-health means, let us watch this video presentation. Actually, when it comes to the e-health, it's all about on how we will take into consideration on our situation that it concerns with how we will access for the information when we have our journey towards the evolution of the transition from this situation of the pandemic. There are some situations that health cannot be accessed simply because of the restriction due to the pandemic. And in our situation now, what could be the next direction that we will encounter when it comes to the hospital information system or the e-health? What does e-health stands for? The E stands for electronic technology. So you have been immersed with how technology happens in our society and in everyday lives. We have we have computers, we have the mobile phones, the tablets that are capable of storing information. Even the internet connectivity and the social media itself. What's it comprised with the e-health? It is already the access on how this information system will be processed using the digital technology. We consider this years already as a digital year or era wherein sharing of information can be accessed through the technology. It could be digitalization of the records. We may not anymore see filing cabinets, but rather storage through the computers. Sharing of information can be done through the healthcare teams. More effective treatment, timely decision-making or clinical decision-making can be done. Test results can be accessed by the patients themselves and the healthcare team members. More quickly because time pays. Better diagnosis because of the access to information for the history and previous diagnostic results. In the Data Privacy Act that we have now, the information are protected. And this can enable the professionals to have efficient use of resources and at the same time, timely respond to appropriate treatment. Anytime records can be available and needed as well by anyone, but with certain limitations, we can receive also care remotely through the telehealth, through the teleconsultation. So sharing of information nowadays is through some portals, and this could be one access or platform. The clinical portal that which we consider the key patient data to access by the healthcare team and the members as well. This is advances in technology. The e-health will enable us to the connectivity and gather rich data. The rich data that we can access is the information that we need for the total care of our client. Even in your own homes, you could receive information necessary to attend high level of independence in your care. Even at 24-hour monitoring, even in your own homes, you can access to your medical practitioners. Just like as an example, diabetes monitoring, we can have only glucose monitoring sensors by which doctors can access information to their mobile phone. The patients themselves can be alerted with the results of the blood sugar. And in case of emergency, this could, I'm sorry, we'll just reuse the sound. So when it comes to the emergency services, this could access specifically the use of the technology when it comes to the information. As an enabling power, the information technology can manage health by providing trusted information that will come from legitimate individuals, meaning those professionals, healthcare providers, and even in the health centers, we are already having this implementation of the e-health. It may give us also the control on who can only access this information. It may provide tools. We have the m-health and we have the e-health. It may give us information on which progress monitoring can be possible. Even in our busy lives, we can just, through the mobile phones or through the search engines, it can enable each and every one of us to access important information. Platforms such as My Health Online. My Health Online is a platform wherein it can book appointments for teleconsultations. There could be electronic prescriptions, and you can even update your information. So with this e-health, what could be the potential change or paradigm shift in the future? It's all about revolution. Revolution on how we will use the technology towards changing our ways but improving lives. The rich data can be used on a comparative analysis to promote and prevent diseases. And probably this rich data can be used also as findings for recommendations. Since we have considered the privacy and confidentiality as an important factor in e-health, this may prioritize the safety and security. So these are the innovations that we have encountered, and we work soon, hoping once you will have your related learning experience, you will be immersed through the use of e-health and hospital information system in our own base hospitals and various affiliating agencies. So thank you very much. Now, with that introduction, with the e-health, our topic for today is all about one platform that was basically introduced in the market in most of the hospital facilities, and we will watch a video as an introduction of one of the platforms of the hospital information system called as Beatsbox. Let's watch it.
We are proud to introduce to you the BizBox Hospital System 8. This is a fully integrated and comprehensive healthcare solution that will help hospitals as well as their personnel with their specific tasks and responsibilities to their patients. The system is composed of the following: the BizBox Hospital Information System, the Financial Management System, Materials Management System, Clinic System and Electronic Medical Record System. Let's start with the BizBox Hospital Information System and discuss the healthcare business process. This includes the processes of patient registration, requisitions, and transactions in the ancillary, billing and cashier. The registration of an inpatient is easy using the Inpatients module, wherein you can view all the admitted patients that are in the hospital. In addition, you can manage the records of these patients that include their profile and registry details. There is an additional feature of the system, wherein it can detect if the name of the patient matches to an existing record. That will be an identifying factor if the patient is old or new on the hospital records. The system can also identify if the patient to be admitted is absconded, and will post a notification that the patient was unable to settle his account from his last visit in the hospital. There are also different transactions that the admitting department can perform. First, we can relocate a patient from one room to another, We also have access to discharge the patient and readmit if the patient decides to come back to the hospital. The summaries will serve as statistics of all the patients in the hospital depending on their status. On the nursing services, which is the nursing department's primary access, we can tag the patient's arrival, that came from the admitting department, for us to be able to get ready for their requests and needs. Requesting for an item or service will require us to specify which department that service is coming from. The inventory balance will show the available items that are ready to be given to the patient. The examination of shots can also be accessed here, that will contain the different examinations done to the patient, as well as the results. The access of this information will depend on the nurse that is assigned to the station where the patient is. The nursing endorsement sheet will be used as a notification to the nurse that will be next on duty. We can also view the list of medicines the patient has taken throughout his stay in the hospital. The ancillary services will list down the different requests of the nursing services, based on the patient's needs. The access of this will depend on the assigned personnel to the different ancillary departments. We can render the requisitions here, and we can also render directly without requiring a request coming from the nursing services. There are also instances where people would like to avail items from the hospital, even if they are not registered, and that will be the purpose of the cash transaction module. In addition, there is also an MGH clearance alert that will notify the particular ancillary department if the patient was tagged for may go home clearance. Using the examination of shots module, we can access and manage the different examinations that were done to the patient. Since every hospital has their own different ways in presenting different examinations to their patients, the hospital system has the capability to let the users design and create their own examination templates that are applicable to their hospital. In this case, using the tools on the examination subcomponents, more specifically the tables and templates, we can create our own examination templates based on the hospital's standards. After the process of creating the examination templates, we can now manage the examination and enter the results on the fields. After finalizing the examination results, we can now release the information to the patient, and also let the nursing services have access to these results. In addition, we can also lock the examination, for us to secure the data and avoid unauthorized access, or unlock to modify or finalize these examinations. The billing department will be responsible of posting different charges to the patient's account, based on the hospital transactions, or the items and services he availed. We can charge the patient for the professional fee of the assigned doctor. And also, we can post a discount, if the patient is eligible to avail one. The post-AR transfer is for patients with guarantor. This is used to transfer the account of the patient to the guarantor assigned. This transaction will automatically be recorded on the billing schedule module. Debit room charge will charge the patient for his use of the hospital room. The SOA billing statement will list all the charges accumulated by the patient based on the hospital services and items that he received. In addition, we can also generate and print the statement of account report of the selected patient. Cash receipts module is the primary function of the cashier in the hospital. This is where all the payments of the patients are being collected. We can receive different types of payments. It can be through cash, card, check, or other types that the patient chose to pay his bills. The patient also has an option to deposit a payment, even if he doesn't have a hospital transaction yet. In addition, this module can also summarize all the collections made by the cashier in charge for the day. Generally, after the hospital received the payment from the patient, it is now time for the patient to be cleared from all the transactions, tagged as may go home, and lastly to be discharged from the hospital. These processes are also the additional responsibilities of the nursing services. In addition to the BizBox Hospital Information System, there is also the Financial Management System that is in charge of the preparation of different financial reports. This is a comprehensive accounting system that's seamlessly integrated with the front-end hospital transactions, eliminating redundant and erroneous entries. It also includes dashboards, cost center, and financial and income statements. The materials management system focuses on monitoring inventories of medicines and supplies in the hospital. Tracking these information is done electronically, which will encourage the hospitals to go paperless. This will include a complete cycle of purchase order and request, stock level monitoring and inventory control. The clinic system will cater to the needs of the doctors in terms of their tasks in their specific clinics. This is fully integrated with the Hospital Information System 8, for easy access and data retrieval and update. It also includes subjective, objective, assessment and plan, or SOAP entries, enables prescription printing and visitation scheduling. Lastly, the electronic medical record system provides a solution for managing, maintaining and retrieving patient medical records. It also secures the different patient records, allows annotations and image archiving. And that's the composition of the BizBox hospital system. Each of them specializes with a certain hospital process, which makes them very important in the effectivity and efficiency of the hospital as a whole. That was the end of the video. Thank you for your time and we hope that you learned something.
Okay, thank you very much. That was the brief introduction about the BitsBox Hospital Information System. If you will notice, it is not just only, the processing is not just only individualized care involving the clients, but the operations itself of the whole hospital. From the time that the client will inquire for the updated billing statement until the access of the nurses when it comes to the laboratory exam results, and updating of records pertaining to the client's information. So these are the coverage of the hospital information system merely considers aspects of financial, which is on the operations when it comes to budgetary, when it comes to the allocation of finances and monitoring of expenses of the hospital. Next, we have also the inventory, which will identify the stocks available, such as the medicines and supplies. When it comes to clinical, if we say clinical, these are more access on the information pertaining to the client's hospital treatment or the client's records pertaining to previous results of diagnostic examinations. So the video can be also be accessed in our Central Lino Pit Stop. It has been uploaded for you for your reference, and if you can watch it again, so that for you to appreciate what the hospital information system and how hospital information system works in a hospital facility. Manila Central University FDTMF Hospital is using the BitsBox Hospital Information System platform. Actually, the point of having hospital information system is to have a seamless process of processing of information from the time of the inquiry of the client outside the hospital until the client is in the hospital, that will request assistance for the services until the client has been hospitalized until discharge. So the process that we encounter, the usual process that we encounter, is through filling out of forms using paper and pencil. But nowadays we can now use various platforms and portals of the hospital that can facilitate entry of information of the data needed. So that's why, as what I have told you, the hospital information system may have two purposes: administrative and clinical operations. The administrative is more on how it will process information related to finances, related to the stocks and supplies inventory, then related on how this information will be used for field health processing. For clinical operations, on the other hand, is these are the access wherein the healthcare team can manage information on the treatment of patients and access to diagnostic examination. It is designed to basically store and manage this hospital information that will promote efficiency. If we say efficiency, this is to maximize the available resources of the hospital. Now, with the hospital information system, we have the so-called health information technology provider. This is one of the features of the Bitsbox platform, the hospital information system, the HITP. This covers verification of PhilHealth online eligibility. So I think the spelling is must be eligibility. It's letter E. And we have the so-called for PhilHealth, the S claims and the E claims. The E claims that we can consider can be accessed by the hospital personnel to the central office of the PhilHealth. The S claims could be accessed through the patient's portal, wherein the patients can use the PhilHealth toward PhilHealth in the processing of his admission in the hospital. So that's what we call HITP. This will process PhilHealth verification. If, for example, you have lapses when it comes to the contribution in the PhilHealth, the hospital personnel can access information if there are lapses in your contribution. Even the clients can manage themselves on the access on the PhilHealth online verification when it comes to HITP. So actually, the three terms that we could use when it comes to the hospital information technology provider or HITP. Kaya pag nadinig din nyo when you enter the hospital, sir, do you have PhilHealth? We will just check it in our HITP. So yung HITP is the access of verification for PhilHealth, because before the the hospital admission office will provide you a form for you to fill out, and you will submit these forms to the central office of the PhilHealth. Unlike now, it can only access the online processing through the HITP. The remittance can be accessed through the ATM, and specifically the continuous monitoring of contributions can be accessed even through months or through the years. So it reduces processing time, faster remittance, and saving the long process or queue when it comes to the proceeding to those offices on long line, uh, and even offices and departments that you will visit. Now, this is the health information technology provider that can be accessed in the hospital information system. If you will notice, we have the member information and we have the patient information. What is the member information? The member information is the one who have uh, processed the membership in the PhilHealth, and we have the what we call dependents. So that will appear on the patient information. Or if the PhilHealth member is also at the same time as patient information, so it will have the same information that can be indicated or filled out. Now, this could be accessed through the mobile, or it could be centralized with a PhilHealth portal, HITP, in the hospitals. So aside from the HITP, we have the SMS notification for doctors, short messaging system notification for doctors. What are those messages that we could have access that we can access through this SMS notification for doctors. Just similar with our situation with the National Telecommunications Commission, that it was already a law that each one of us through the NTC will receive status report if there are disasters, updates when it comes to disasters. So it is programmed accordingly as short messaging system. So similar in a hospital for the SMS notification for doctors, if for example, the doctor had been informed that she or he was decked with a client in the emergency room, then even though the doctor is not yet visiting the the emergency room with the patient, she or he can already access through the text messaging system or SMS notification for doctors that he or she will have patients to be attended by the doctors. Actually, before, I think we have a question. We have a question ni beeper po ba? Okay, before I have encountered that. I even during my time have the beeper. Ang beeper kasi it will still pass through a parang an operation office, what do you call that? the the central office, yan, the central operations office. So parang it's just similar when you are being attended by a customer service specialist, yun yung sa beeper. But for now, for the short messages, short messaging notification for doctors, just like our experience now, that the as long as you have the data or you have the connectivity, you can direct the message to the doctor, or the hospital itself has an automatic access on messaging system that the doctors will receive every time that the nurse will enter information. The doctors can already have the access of the information. Di ba there are some instances emergency, but the doctor will still come from a far place. While on his travel, he can now already access those information through the SMS notification for doctors. Very a very brief message but very important message that the doctor may have. Example, signs, initial results of diagnostic exams. So this will give the doctors a quick preview. Pag sinabing preview, from the signs and symptoms, from the initial results of diagnostic examination. So upon arrive, even on the travel po ang doctors, the doctors can already give instructions to facilitate initial treatment or medical attention to the client. So if, for example, the SMS notification for doctors may not just only indicated for admission, but the SMS notification for doctors can be also accessed for outpatient consultations. So for example, the client wish to have an appointment with the doctor. If, for example, the schedule was already taken and reserved, it will go back, or it will have a feedback message to the client that the appointment schedule had been reserved. So these are now the ways by which the hospital information system can access when it comes to appointments. Now, this is a typical example of SMS notification for doctors. So this is the inpatient registration form. While once the nurse enters the basic information, the doctor will already receive basic information from the name, from the age, admission room, date and time, and the chief complaints. So at least the doctors could have the preview already. It's not actually it's not the nurse will enter into a text messaging through using a mobile phone, but it is already embedded. When the nurse enters, the doctor or the attending physician, automatically a message will be received by the doctors, or notification to access basic information of the client. So that is the SMS notification for doctors. We have naman the balance detection for patients with unsettled accounts. Okay, for example, the client will be subject for discharge. So there will be an alert feature, specific schedule that the clients will be updated with their billing statements. However, if the clients already uh, settled to the billing department, there are situations that the billing department will still have some charges which have not been included by the nurse. So there is an alert feature that will alarm, or not, or that will alarm, yeah, that will alarm and inform the clients of certain balance because it was not included in the updating of accounts of the client. So this is a matter of, just like now, it is compared with the online banking. It can facilitate the access for the daily transactions. Yung, for example, for the status report of your billing when you settled, it will update your balance once it goes again with the scheduled updating of the billing statement. So this could be also exported and can be printed as well for your reference when you are about to submit it in your institutions. So mag-a-alert talaga siya. It can actually monitor the financial records, and it will notify the clients when it comes to the unpaid transactions. So this is the one that can be accessed, yung patient's outstanding account balance alert. So it indicates here the patient name, the patient ID, yung total debit, meaning yung balance, and the total credit. So outstanding balance will appear. So it will pop up. It will really pop up to the client that this will process. Now, when the client is about to discharge, the discharge registry account will identify if there is still unsettled balance. So yung isa is for purpose of inquiry. Yung isa is it will alert you if you still have unsettled balance prior to discharge. This is for process of clearance of clients. Now, inventory stock on hand display. So if we say inventory, it will give us information of the stocks of supplies. Yan, stock of supplies, medicines, intravenous fluids, and even supplies and other equipments that are being used by the hospital. And this will alert the person in charge, specifically in the central supply room, if there is a past transition on the use of a specific drug or specific supplies, so that there could be a pre-ordered processing already of the supplies if it has past transition. Just like in the recent pandemic that we experienced, there are some common supplies and drugs that are being used, and this must already have an entry of entry and updating of utilized supplies, so that it will alert and have information of inventory balance that can be accessed by all healthcare team members. For example, for nurse in the other ward and the other one is a nursery, they are in need of common supplies, but the stocks are only one. So one may compromise. So that's why there are some situations that the client will be requested to purchase the needed supplies. So to prevent this, the inventory stock and hands-on or stock on hand display will have a real-time monitoring of the available supplies, which this is the typical example. For example, for a drug, in the patient's name, kasi for example, if the client, usually ang pag-stock ng drug for each client daily is, for example, 3 times a day. So it is expected that the client must have a request of 3 tablets in a day. So this will identify already the stock of the drug, and at the same time it will appear also here yung amount that is in particular naman for the access of the billing statement. So the nurse can also access how much na yung billing statement based from the number of requested medicines. That's inventory. Patient's kiosk. So patient's kiosk are a convenient tool. So what do we mean by convenient tool? These are the access that mainly caters the stakeholders, the patients. So for example, if the client wish to know if there are available dermatologists on board for today and tomorrow, he or she can already access it because patient ID or password will be unique and be given to patients to hospitals stakeholders. So this password and access could be changed for purposes of security. So another, when it comes to the patient's kiosk, if the hospital has other partner hospitals, for example, if you are looking for the stock of blood, and if it's not available on the hospital where you have been or where you are admitted, then you can access other hospitals who have stocks pertaining to the blood and where you can access or purchase blood. So this will give us the easy access talaga that the patient must know. This is the must know platform or kiosk or feature of the hospital information system. Thus, the patient kiosk may have an organized list of health benefit providers, meaning from the medical to the billing records. That's why there are some instances you will process documents in the social welfare office. Then, if the patient will be given an access on the patient's kiosk, he or she could just show the access to the social worker in the hospital, and it will be validated accordingly. Unlike before, we need to have the printed documents as thick as this to be submitted in the social welfare so that it will be processed. But if the patient ID will only be provided to the patient and be given to the social welfare office or desk, this could be accessed na lang without papers on hand. So ito po yung tinatawag nating patient's kiosk. So with the patient's kiosk, for security purposes, the patient may have the original or have his or her own patient ID that will be provided by the hospital, and your name will be indicated as last name so that you can access eventually the information that you may need for billing, medical records, or supplies that could be available in the hospital. So this is what we call patient's kiosk. When it comes to flexible pricing and discount schemes, okay, if we say discount schemes, what are those situations na we need to give discount? Number one, senior citizen, right? Di ba sa senior citizen, they deserve discount, 20%. Okay? Disabled. Okay, the disabled, they have the PWD ID. They are entitled for discount. So that's why the flexible pricing and discount scheme feature of the hospital information system can fit to the needs of the stakeholders. And these schemes that we are talking about is called the socialized pricing schemes. Why it is called a socialized pricing schemes? Because this may consider a specialized price schemes for senior citizens, persons with disabilities, pwedeng employees who are working in the hospital, and those who may have share of stocks. So these are what we call flexible pricing and discount schemes that are what do you call this, that are tailored accordingly to specific population groups aside from the regular pricing of the services and supplies available. So ito po yung example of flexible pricing and discount schemes. It can already identify here if the client is already a senior citizen, and all with the flexible pricing, you will just click or tick the client status, and the client status is senior citizen, and it will automatically apply the pricing for senior citizen or PWD. Next, barcode system. For barcode system, the purpose of the barcode system is a useful tool to manage patients' security through the codes. Kasi pwedeng barcode siya, pwedeng QR code. Our mobile phones our mobile phones can definitely read barcodes and can definitely read QR codes. This is for purpose of faster and making transactions easier. The most common that we have now is our Paymaya, the GCash that can be managed by QR code or barcode. So similar with the hospital, they are using the codes for purposes of identified items and services that may not merely identify the text, but it can direct you to information accordingly of what has been stored or what has been programmed in the hospital. So that is what we call the barcode system. So this is what we call the barcode system. So the barcode system with the barcode ID, once it is already scanned, you can access the inpatient's registration system. Next, we have duplicate detection. If we say duplicate detection, there are some instances that yung errors that we may encounter na, oh, why it's double charge? So why is it the same information was entered, the information on diagnostic results is already available. So it will pop dun sa system that it will prevent multiple entries with similar information. That's like, for example, the nurse may not be aware that the other nurse already entered basic information of the client. So here comes the nurse in the ward who will enter again the basic information. So it will have duplicate detection. So meaning since the information is already secured, it will not be any more altered, or it may not be any more deleted because it is secured by the one who initially processed the information, and it has a corresponding locked ID or password. So this can track the patient's record as well. So this is what we call, this will appear similar record found for though. John, would you like to proceed? So that's why this will prevent errors as well, because it has a centralized database. So this is the duplicate detection system. So this is the coverage of the topic 5, and we will now proceed to the topic 6. For the topic 6, we will discuss all about the hospital information system, and this is in connection with what we call electronic health records. So when it comes to the electronic health records, if we have the hospital information system, we have converted the paper document into documents that can be accessed through electronic system. Just similar with the previous accreditation that we attended last week, the accreditors will not anymore visit their school. So the accreditors can just only scan the documents that had been sent. So it is just similar with the electronic health records, which is also part of the features of the BITS box. Let us now have a glimpse of the history of medical records, electronic medical records, and how this has evolved on its purpose in our healthcare system. Let's listen.
Today, it's easy to think of electronic medical records as just a substitute for paper record keeping and little else. That kind of limited view obscures the massive advances made in the nature of healthcare today, which has a rich history. A doctor in 1940 transported to today would be shocked at the changes in healthcare due to electronic record keeping, which has changed the course of medical science as we know it. The real history of electronic medical records dates back to the 1960s with problem-oriented medical records. That is, medical records as we understand them today. In the 1960s, Dr. Larry Weed's problem-oriented medical record was a breakthrough in medical recording. This innovation allowed third-party facilities to independently verify the diagnosis. But before Dr. Weed's system, a doctor only had access to their diagnosis and the treatments they provided. Now, new doctors had access to a patient's entire medical history. In 1972, the Regenstrief Institute develops the first EMR system, but the system fails to attract many physicians. But by the late 1980s, low-cost personal computers gave way to widespread adoption of EMRs. Large hospitals can now provide the same level of servicing for each patient without worrying about specific doctor-patient relationships. However, the technology didn't really gain traction with smaller facilities or private practices. Regardless of their adoption rate, many practice management functions, such as billing and scheduling, were being moved to computers. And in the 1990s, the establishment of the internet made accessing health information online easier than ever, setting the stage for web-based EMRs. In 1991, the Institute of Medicine recommended that by year 2000, every physician should be using computers to improve patient care. In 2009, President Barack Obama signs ARRA into law. The American Recovery and Reinvestment Act provided incentives for healthcare facilities who demonstrate meaningful use of electronic medical records. Today, electronic medical records are increasingly paperless. Patient medical records are more accessible than ever before, meaning that data technology is on the verge of becoming fully portable and comprehensive. Even with all the advancements in EMR technology, 70% of physicians are unhappy with their current system. Specialists especially have difficulties adapting to their EMR software due to their different needs and areas of focus. However, EMRs are becoming increasingly specialized for different areas of practice and environments, allowing you to easily streamline workflows, improve data entry, and increase doctor-patient interaction. NetHealth fully believes in creating better outcomes for clients and their patients. Discover for yourself why over 3,000 facilities rely on NetHealth each day.
Okay, so those are the history of electronic health records. From the time that we have discovered the internet connectivity, the physicians are already mandated to process records using the computers. And it was in 90s. I even remembered during the time that the big size, the huge size computer, not with the flat screen that you are seeing now and the laptop that you're seeing now. We are using a huge computer with a big monitor during the time of 90s, and it was the time that it was first uh, presented in the market, and that's the time that the healthcare team and the physicians and even the doctors are mandated to use the computers. There in at the start there are resistance because of the situation that the individuals normal reactions that transition, paradigm shift, adjustment, these are normal reactions. However, it is part of our system that our flexibility goes on how we will adapt to these changes. And this is what we are now when it comes to this embraced reality. So actually, if we use the term digital versions, the digital versions are the scanned versions, the paperless version. So it may not be on hand, but you can visually see the document using the various gadgets or platforms. So typically, electronic medical records can facilitate the access for the treatment and medical history of the client. Now, when it comes to the clinicians, uh, it is similar when you will have your clinical visits in the hospitals wherein we have the patient's chart. The patient chart may have all the information of the client as well as the information provided by the healthcare teams. The clinicians we are talking about are those who have participated to the care management of the client. So this is what we call electronic health records. Actually, the electronic health records provided us a major solution when it comes to reducing errors. Why? Because anything that has been stored can be detected eventually. Just like a while ago, we have discussed about duplicate detection. It can pop. Okay. Another, if you have missed some of the portions that you filled out in a certain platform or survey, it will call your attention that you cannot proceed to the next phase or step. So these are the features that will automatically can be programmed in a system. So that's why even in the electronic health records, it may reduce errors, it may ensure privacy because it is provided with password and ID. So as what we have mentioned, the barcode system or the QR code, and efficiency. If we say efficiency, this will create an environment that is timely and appropriate treatment are deserved and being given to the clients. Now, uh, the counterpart of the electronic patient chart is the traditional chart paper that is inserted in the patient's chart. Now, the electronic patient chart could be the source of information. The difference is that of it is designed lang that can be accessed in the platform of the hospital. So meaning those doctors who are given the password, those doctors who are given only the IDs, specific IDs to access the information can be done through the patient medical info or electronic patient chart. So if we say electronic patient chart, these are the patient's information that manage accordingly data or information available based from records of the client, diagnostic lines of diagnostic examination, remarks of nurses, and doctors' orders, which are very important on how to monitor the present condition of the client. Now, this is a typical example of patient medical info. We have the patient history. It can already access if you click the allergies when you are about to give a medication or drug to the client. It can already identify the specific drug. So just like when you click the allergies, he or she has the seafood, allergy type is food, then reaction, the patient has heart palpitations. So this basic information may give the idea to a nurse who was giving a drug. If, for example, prior to this, the client who may have seafood, so kung seafood and you will give, for example, a drug, ang seafood may iodine siya. How about if you will give a drug that has an iodine that is when the subject will be subject for diagnostic exam? Will that be possible also to contribute into the hypersensitivity reaction? The answer is yes, because this will eventually contribute basic information, but it could be helpful for the nurse to manage preventive measures. So it may include here past condition, drug history, surgical history, immunization history, personal, social history, and even family history. All complete information can be in the patient medical info portal. We have the vital signs graph. Okay, vital signs, we have the blood pressure, temperature, pulse rate, and the heart rate. Uh, Automatically, just like when you appreciate the purpose of Excel, then if you wish to insert a graph, so once you enter a data into the Excel, automatically it will create a graph. This is a similar, the vital signs graph that can be found in the hospital information system and an electronic health records. So just similar as this is the latest vital signs, and it will give you also the monitoring, the analysis itself of when is the time the client has the peak of problem with the hypertension and the lowest blood pressure that the patient have in a 24-hour monitoring. This could be also useful other than the vital signs graph, yung labor pace monitoring. This will give us also the information of analysis, yung progress ng pace of labor. This is one other than the vital signs graph. Another is we have the what we call e-prescription. Okay, the e-prescription which is now used nowadays, na ako I'm looking on the in the future na ang mga mobile phones ninyo can print automatically. Will it be possible? Yes, that could be possible. Sooner or later, there will be mobile phones that can print automatically papers or documents that may not need anymore. For example, if your mobile phones are not working, but you can but the individual may need the paper or as a proof or evidence, you can print in your own mobile phones. Will that be possible? Yes, in the direction of the new technology, that is very possible. First, the input of medicine prescription, the common information that is indicated in an RX or prescription. So this may reduce errors simply because the doctors themselves are the ones who have only the access on that e-prescription. So this is a typical e-prescription. So it will just enter in the portal, the medication, the dosage, and the privacy setting. Then once this will appear to the client and access the e-prescription, this is the image he or she can access. So complete information na siya. So next, we have the document management system. For document management system, this is specifically image. For example, image. You will just instruct the client at home. For example, can you take a photo of the wound you have in your knees? So this document management system can track specifically yung development from day 1, from day 2, even in your own convenient homes. So that's why when it comes to this document management system, for example, a typical photo lang ito ha, a typical photo for the client to understand what does ear infection is. So the doctor can share a photo wherein the specific location of type of infection is identified. So then how the doctor can validate it. The patient can send through this portal of document management system the actual discharge that is coming out from the ear, and it will send and attach again the photos in this document management system. So the exchange of photos can be tracked, can be stored, and can be protected as well because it will be accessed only between the clients and the doctors. Now, the seamless information exchange. Okay. The information exchange that we're talking about, ito yung tinatawag natin, di ba, na interoperability standards wherein you can exchange information from each other. So seamless siya. So pag sinabing seamless information exchange, this could use the shared information either from colleagues themselves, from nurses themselves. So parang it's just the same in our central Linux pit stop. We can create our own group, but here it could also identify, for example, the basic information when, for example, the nurse on the next shift will be late, but the nurse has already the overview of the patient's condition who are admitted in the ward before he arrived in the area. So yan yung tinatawag natin seamless information exchange. Next, pediatric note growth chart. Okay. This will basically identify as part of the platform of the hospital information system if ito similarly to sa mga body mass index that will consider the ideal body weight. Tapos sa patient's growth chart, this will identify, di ba, specifically yung specific features and needs per age level or age group. So automatically yung normal graph kasi syempre for growth, obviously it's increasing as it is expected also on the specific age. What is the usual weight that is expected for children ages 2 years old until with the succeeding age. So if you will notice in this graph, this pediatric note may identify the normal graph that are expected on a normal reference and the graph that basically identifies from the records appeared with the patient. So this will have a comparative analysis from the growth chart. So data trends. Okay, sa data trends naman, this is the specific feature of the hospital information system. Pwede to by mobile. Now, if you have an access, for example, top trending medical cases. So pag for example in the hospital, top trending number of admissions. For example, top trending hospital utilization capacity of the hospital is full. So nagpa-pop up agad yon. So ang bilis nung transfer ng information even though you are not asking for it, but it will already pop the data trends. So that's why diyan pa lang magpa-pop na yung mga basic information. And other than that, this will identify na agad yung for example, chief complaints of the clients. The highest ngayon po ay ang count natin ng mga complaints of our clients are in the neuro ward are headache. Okay, so we really need to manage it with the referral to neuro. So this will this will give you the idea even before you arrive with the hospital. So I think we have already finished the topics for the topic 5 and 6. So I'll stop my recording as well.